and they have to take one step at each count. Or we can just say clap, 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 and they have to walk on each clap. Or if someone in your family is living with Parkinson's, then this video is for you. Not to blame, not to pointing fingers, but to guide you. As a neurophysiotherapist, I meet families every single day who are trying their absolute best. They try to sacrifice their time, they try to change their habits, they show up every day. Yet, there are few small unintentional habits which they think they are doing out of love, but they're actually slowing down the progress. Namaste, I'm Dr. Alisha, a neurophysiotherapist, and I welcome you all to another video from Sakshyam Physiotherapy and Rehab. And in this video, we are going to share with you few mistakes that the families with Parkinson's care do without even realizing it.
So one of the most common mistakes we see every day is trying to help them with everything. You see them struggling with buttoning up a shirt, you see them struggling with the walk, and out of care and love, you try to help them more and more. So in Parkinson's cases, they need those small movement practice on a regular basis. So जब आप उनको बहुत ज़्यादा हेल्प करने लगते हैं, their brain stops activating those pathways. So धीरे धीरे that slows down the progress or the recovery. So you try to help them, but don't try to replace them.
Another common mistake that we see every day is whenever a patient walks into the clinic. So if they freeze, the family members would say, "Arey, ruk kyun gaye? Jaldi jaldi chalo." Or they will just continuously ask them to walk fast, या फिर बड़े-बड़े steps slow. But we have to understand that Parkinson's gait is not a habit; it's a brain signal issue. So instead of correcting them again and again, we can use external cues that would help them better. For example, अगर वो walk कर रहे हैं, तो we can ask them to walk on every step count, like 1, 2, 3, and they have to take one step at each count. Or we can just say clap, 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 and they have to walk on each clap. Or inside the home, we can just put visual cues like इधर steps डालना है, ऐसा चल के जाना है. So when we start giving them cues, that gives them a positive reinforcement. But when we keep correcting them repeatedly, that gives them a negative reinforcement.
So the third most common mistake we see on everyday life of Parkinson's cases, that some days would be there when they will feel a lot better, their walking will be better, even their muscle stiffness will be less. And at that point of time, the family members think, अभी थोड़ा उनको rest लेने देते हैं, because everything seems fine. But actually, we are delaying the recovery process during that, because the balance training, the posture correction, the strengthening, these things will help to delay the functional decline. So consistency of the exercises matters more than the intensity of the exercises.
So a few of our patients जो clinic को आते हैं and they don't believe in exercises, वो बोलते हैं कि medicine ले रहे हैं ठीक हो जाएगा. Yes, medicine helps manage the dopamine level. They are very much essential. But tell me, क्या medicine आपका posture train करता है? क्या medicine आपका balance training में help करता है? या फिर after a fall, can a medicine help you to regain the confidence? No, right? For all these activities, you need regular physiotherapy and regular exercises. And always remember, Parkinson's treatment is always multidisciplinary.
So this mistake bothers me a lot. During consultations, the family members, they try to answer each and every question. What he can do, what he can't do, what she feels, what she doesn't feel. So when you start answering instead of the patient feels more and more unheard. And that's when they start keeping them more and more isolated. What we have to understand, Parkinsonism affects the movements. It doesn't affect your intelligence level. It doesn't affect your awareness level. We have to involve the patient in the conversation. And even if it takes a bit more time, let them speak.
Living with Parkinson's is already challenging. So as a family, you need to understand the right approach. You should be encouraging them to put in more efforts. You should allow them to be independent. You should encourage them to be consistent with the exercises. You should be patient with them. And remember, caring someone doesn't mean you have to do everything for them. It's about helping them do as much as they still can. Okay, and if this video helped you to understand Parkinson's better, do share it with someone who is living or helping a Parkinson's patient. And keep following us for more physiotherapy and health related updates.